Hi, my name is Navarro, and I'm a graduate student from Northern Illinois University. I'm also one of the administrators for the Comparative Effects of Exercise and Transdermal Trigeminal Nerve Stimulation on Psychological Feeling States. We believe that our research is significant as we see the physical and emotional well-being of college-age individuals have gained significant attention, especially during the COVID pandemic. We know that exercise has offered many psychological benefits on emotional processes like stress and depression, and physiological processes like heart disease, hypertension, diabetes, obesity. Physical activity is commonly recommended as part of a treatment for those suffering from emotional disorder. Research also suggests that exercise can enhance positive mood, ameliorate distress, decrease anxiety, and alleviate depression. And exercise is great. It offers all these benefits. However, if we're not exercising, we're not going to get any of that benefits. And that's what we've seen through research where few young adults have actually engaged in that significant regular exercise to achieve these physical and psychological benefits. Reduction in anxiety and physiological responses to stress have also been seen with transdermal stimulation and of the trigeminal nerves. Perhaps transdermal stimulation of the trigeminal nerves is an alternative intervention for physical activity interventions to reduce anxiety and stress. We don't know of the comparative effects of these two interventions. The purpose of our study is to examine the comparative effects of acute, moderate to vigorous physical activity to the transdermal stimulation of the right trigeminal nerves on one's perception of positive and negative effects. Another way of saying this is emotional well-being. For our research study, we use 23 healthy college-age participants ranging from the age of 19 to 24. In our study exactly, we had 21 males and 2 females. The instruments that we use for our research study is a positive and negative affect schedule, also known as PANAS. This measures dimensions of positive and negative affect. This is a 20-item prompt using verbs to describe how one feels at the moment. For example, we give is interested, alert, ashamed, happy, sad, depressed. And it uses a 5-point scale where 5 being extremely, and 1 being very mildly, very slightly, or not at all, and 3 being moderately. So for example, if someone rates a 5 on our PANAS, that means that they feel very much in that emotion. For our data collection, it's collected multiple times throughout the session. Our initial time is when we do the initial screening for our participant, which include a state trait anxiety inventory and a cardiorespiratory fitness, aka Gerkin protocol treadmill test. The PANAS is collected 3 times throughout the study. The first time is when the participant arrives in the research session. The second time is recorded before a condition. We have 3 conditions, one in which is quiet sitting, where our participant sits in a chair for 15 minutes while being quiet. Second time is exercise, where our participant performs a moderate to vigorous aerobic exercise for 15 minutes. And the last time is stimulation, where a stimulation patch is placed on the right trigeminal nerve for 15 minutes. After that, the third time is recorded after the condition. Once the PANAS is completed, we take that and take the 20-item prompts that are separated into 2 groups of 10 items, positive affect and negative affect. Each are totaled separately with a score ranging from 10 to 50. Having a higher score represents a higher level of positive and negative affect, and having a lower score represents lower levels of positive or negative affect. It is separated 3 times with our 3 conditions, treadmill, nerve stimulation, and sitting quietly, times 2 times with our repeated measure ANOVAs. Our expected result for our study is that the acute, moderate to vigorous physical activity will produce higher positive affect compared to both the transdermal stimulation on the right trigeminal nerve and the control condition. And we also believe that the transdermal stimulation of the right trigeminal nerve will produce a higher positive affect compared to the control condition. These are our references that we use for our research study. So I recommend, if you're interested more about the topic, I recommend going through our references first. And any questions at all for our research study.